Women who have a poor concept of self are always more vulnerable. However, different times in our life cycles can make us more vulnerable. So going through puberty with the great body changes at that time makes a young woman more vulnerable. Going away to college, through marriage, maybe the beginning of a career, changes of a career, pregnancy and then childbirth, and again the changes in the body at that time, going through the aging process, maybe empty nest, children leaving home, being in the sandwich generation between looking after children and parents or in-laws, grieving as we lose a loved one, marital difficulties through death, maybe remarriage, and before that dating, which can be quite difficult for an older person, and then through remarriage and blending of a family. Eating disorders can follow a woman throughout her life cycle. Unfortunately, even very young preschool children are now coming down with eating disorders, but there are certain times where a woman is more vulnerable. The changes in pregnancy, for instance, when a woman will gain weight, her bodily composition will change to a higher percentage of fat necessary to nurture her new baby, and then afterwards through lactation a woman's body will change. There is a tremendous pressure for women to lose weight after a pregnancy, often too fast, often faster than what is healthy. It used to be that women would have a certain amount of leeway as they got older, but now we're a society that expects women to look young even if they're not. So the pressure doesn't go away. So women going through menopause are expected to hardly age a bit. There is a lot in the media, advertisements for plastic surgery or things to slow the aging process. You know, whether it be through various kind of hormones, medications, it doesn't stop. So women never get beyond being left alone by the media to look better. If a person has had an illness like an eating disorder for most of their lives, it is far more difficult, which is why it's really important for younger women who have eating disorders to get treatment promptly before it becomes entrenched, both psychologically and physiologically. There are many long-term health issues with eating disorders, such as low bone calcium and osteoporosis in the older years, or even younger years. So it is important to get early treatment. For women who have developed eating disorders late in life or who have had them all the way along, there is treatment, but again, it is more challenging for them to make such a change, a positive change later in their lives. It's also difficult if they require inpatient treatment to find a facility that takes them. Many have a cutoff in age, and so for those who are older, it's often difficult to find a treatment program. And those older women who have Medicare, for instance, don't have a lot of choices. They often have to go out of state to get treatment if they require inpatient units or programs. So it is important to get treatment earlier on and work at the treatment before it becomes so entrenched.